Hello everyone, myself Mahakash Rakshit. I'm a second prop MBBS student from NILRATAN Medical College and Hospital. Today we will discuss about a very important topic, very frequently asked in prop examinations, that is femoral triangle. So what is femoral triangle? Femoral triangle is a triangular depression located in the upper one-third of the anterior compartment of front of thigh immediately below the inguinal ligament. So let's look at the location of the femoral triangle. Look, this is the location of the femoral triangle in the upper one-third of the anterior compartment of thigh immediately below the inguinal ligament. So what we have to know about the femoral triangle are, firstly, their boundaries, its boundaries. We have to know about its roof, about its floor, about its contents. These we have to know about femoral triangle. So let's talk about the boundaries of femoral triangle. So what forms the lateral boundary of the femoral triangle? Let's look at a diagram. So this is the muscles of the anterior compartment of thigh. You can clearly appreciate this is the sartorius, this is the adductor longus, and this one is my inguinal ligament. So what forms the femoral triangle? Follow this line. This is the medial border of the sartorius. This is the medial border of the adductor longus, because this is the adductor longus. So these are the boundaries of femoral triangle. So the lateral boundary is the medial border of the sartorius, and the medial boundary is the medial border of the adductor longus. So give caution here that sartorius is outside the femoral triangle, but adductor longus is inside the femoral triangle, right? And here is the inguinal ligament, which forms the base of the femoral triangle. So what is the apex of the femoral triangle? Where the two boundaries meet, that is the point where the medial boundary of the adductor longus and the medial margin of the sartorius meet. This point is the apex of the femoral triangle. Alright, so now we know the boundaries of the femoral triangle. Now let's talk about the floor of the femoral triangle. Floor of the femoral triangle is muscular. It is formed by four muscles. From lateral to medial, these muscles are iliacus. You will not clearly appreciate the muscle belly of psoas major, but you will get to see the psoas major tendon. So iliacus, psoas major tendon, pectineus, and adductor longus. These four muscles form the floor of the femoral triangle, right? These are the four muscles. Now let's talk about the roof of the femoral triangle. If we apply our common sense, we will certainly be able to write the roof of the femoral triangle from superficial to deep. So what are the structures which will form the roof of the femoral triangle from superficial to deep? Obviously, the most superficial structure will be skin. Deep to it there will be superficial fascia. Now give caution that the superficial fascia of the femoral triangle contains, in the region of the femoral triangle, contains certain structures in it. Firstly, you will get superficial inguinal lymph nodes. You will get to see some cutaneous arteries. You will get to see some cutaneous veins, among which the most important one is the great saphenous vein, which comes in the superficial fascia, pierces the deep fascia of the thigh at the region of the saphenous opening, and then drains into the femoral vein, right? For the details of this venous drainage, you can check out the venous drainage of the lower limb present in our channel. I will give the link of that video in the description box, right? The most important superficial vein present in the region of the femoral triangle is the great saphenous vein. You will get to see some nerves here. So what are the nerves present in the superficial fascia of the femoral triangle? Firstly, it will be ilioinguinal nerve and the femoral branch of the genitofemoral nerve. This femoral branch of the genitofemoral nerve supplies the skin of the femoral triangle, right? This is the importance of this nerve. And the third layer the third structure forming the roof of the femoral triangle from superficial to deep is my deep fascia of the thigh region, that is the fascia lata, having one opening called saphenous opening, which is covered by cribriform fascia. So to summarize, the roof of the femoral triangle from superficial to deep, we will get to see the skin, the superficial fascia, and the fascia lata along with cribriform fascia in the region of the saphenous opening. Right. So let's see a diagram. Look, we have reflected the layer of the skin and the superficial fascia. Now we can get to see this fascia lata here. This one is my fascia lata. You will clearly appreciate this muscle. This one is my sartorius. From anterior superior iliac spine to all the way from lateral to medial side of the thigh, this one should be the sartorius muscle. Okay, so this is the lateral margin of the femoral triangle. So look, the femoral triangle's roof is formed by fascia lata, right? And there is an opening called saphenous opening, which is closed by cribriform fascia, right? And the great saphenous vein is draining from superficial to deep towards the femoral vein through this saphenous opening, right? So now we know about the roof of the femoral triangle. Now we have to know about the contents of the femoral triangle. What are the things present inside the femoral triangle? So let's talk about the contents. Firstly, we will get to see femoral artery, then femoral vein, just medial to the femoral artery, just lateral to the femoral artery, we will get to see femoral nerve. We will get to see deep inguinal lymph nodes, this one is 4. We will get to see nerve to pectineus as a content of the femoral triangle. We will get to see another important structure, which is fibro fatty tissue. Why I am calling this important? Because this structure is present in every spaces of the body, in all regions, right? So fibro fatty tissue, nerve to pectineus, deep inguinal lymph node, femoral nerve, femoral vein, femoral artery. And one more important structure, that is the lateral femoral cutaneous nerve. The femoral artery and femoral vein is covered by a tough fascia in its upper 3 to 4 centimeter region, which is called femoral sheath. The detailed discussion about the femoral sheath will be done in a separate video, right? Let's draw a diagram. So it is my sartorius. Let's say this one is my anterior superior iliac spine, and this is the pubic tubercle. So here will be my inguinal ligament, right? Inguinal ligament, and let's say this is the adductor longus, and this is sartorius. So by definition, this will be my femoral triangle. From the mid-inguinal point, the femoral artery goes right up to the apex, right? So this is my femoral artery. Then the just this is the medial side, this is the lateral side. Just medial to the femoral artery, you will appreciate the femoral vein. On its course, at the region of the apex, you will find the femoral vein just deep to the femoral artery. From above downwards, it goes deep to the femoral artery, right? And its upper 3 to 4 centimeter of these vessels are covered by femoral sheath, right? So this structure is my femoral sheath. Inside the femoral sheath, you will appreciate the deep inguinal lymph nodes, right? Just lateral to the femoral artery, and outside the femoral sheath, you will appreciate the femoral nerve entering in the femoral triangle. In this region, you will get to see the lateral femoral cutaneous nerve. So this is my femoral nerve prior to crossing the inguinal ligament. Before passing the inguinal ligament, it gives off a branch called nerve to pectineus, which goes behind the femoral sheath and supplies the pectineus. So nerve to pectineus is also a content of the femoral triangle, right? So these are the contents of the femoral triangle. Now let's see some diagrams. Here you will also appreciate the same structures. Here is the femoral artery, femoral vein, lateral femoral cutaneous nerve, femoral nerve. This is my femoral branch of the genitofemoral nerve, right? And here is the deep inguinal lymph node. We will do a detailed discussion on the femoral artery in a separate video, right? So that's all for today. We have discussed the muscular regions of the femoral triangle today, and hope you guys have enjoyed the video. If you have liked the video, hit the like button, and if you are new to our channel, hit the subscribe button, and don't forget to share with your friends. You can also join our Telegram channel to get such amazing handwritten notes and answers of previous year's question papers. So that's all for today. Have a good day. Stay happy, stay healthy. Tata, bye bye.